Welcome to Glow Time with Jackie. It isn't about chasing youth, it's about owning your glow, reinventing your story, and showing up like never before. Glow Time starts now.
Hey, Glow Babes. Welcome to Glow Time with Jackie. I have a special guest today,
Hi.
Dr. Sutaria. Tell me a little bit about yourself, Dr. Sutaria.
Hi, Jackie, and hi, audience. I'm Dr. Ranchana Sutaria. I'm a founder and CEO of X Factor MD Med Spa. I am a board certified OBGYN, practicing for over 20 years. So here I am.
Yeah, thank you for being here. So I'm so excited to have you on today. We have so much to cover.
Yes,
So
definitely.
I have been looking at your page, looking at all your procedures, and I am so interested in what you have to offer. So we want to talk about the O shot, which sexual wellness, sexual health, as you know, is something that we don't want to talk about. Everyone is so scared. They don't want to talk about it out loud. Everyone is timid to talk about this subject, but we want to get on the subject of dysfunction, sexual dysfunction.
Let's talk about it.
Yeah. So for women, there's a special treatment called O shot.
Yes.
For men, there's a special treatment called the P shot.
Yep.
Which is so interesting. And then also we were going to get into the hormone treatments. We want to talk about what works, what doesn't work, when it's time to get on them, and that's where we want your advice. Okay. So let's get into, tell me a little bit about the O shot.
Okay.
Tell me what it treats.
Awesome. So thank you for inviting me here, first of all. And it is so important to talk about this factor because nobody talks about this. Sexual health is real and sex is natural and real. So why not to address all the concerns that we have about it, right? So O-Shot is basically a very genius innovation which was done by Dr. Charles Runnels, who is a pioneer in this subject, and we all got training from him. O-Shot is basically a PRP treatment. PRP is a platelet-rich plasma, which is your own natural body healer. So what happens is we draw a little bit of blood from your body, spin it, extract all the interesting growth factors, which are basically the healing factors, and inject into a private area. So with O-Shot, it is mainly a kind of natural vaginal rejuvenation where we draw blood from your body and then spin it, extract all the growth factors, and then inject into the area to make it increase sensitivity, to improve the arousal, and also to improve the lubrication. And it works great in patients on whom hormones are contraindicated for a lot of menopausal complaints or for vaginal dryness.
Right. So, okay, what happens is, is this for premenopausal women or for menopausal women or for anybody?
So it has many benefits. It's mainly popular for sexual health and for improving sexual enhancement, but mainly it can be used for any kind of vaginal dryness. And this can happen at any age, right? We all, not many people know about that, but certain women go under premature menopause, even in their 30s and 40s, right? So it can be for any patient who has issues with vaginal lubrication, painful intercourse. It even helps immensely with stress urinary incontinence, which is a kind of incontinence that a lot of people suffer from, but they do not talk about.
Yeah, so I've heard about that. There's a lot of women that have, when they sneeze, they pee a little bit. When they laugh, they just can't seem to hold their bladder. And once almost like they start drinking water, they have to go 10 times a day even.
Especially after having some kids or pregnancies.
Yes. Okay, so this will help with that.
It does help. So for the treatment for that basically is medication or surgery, but this is a very natural way of treating it.
Right.
I'm not going to say that it helps 100%, but it definitely will improve your sensation and bladder control a lot.
Okay, wonderful. And then for sexual function, because yeah, a lot of times women aren't, either they're just not able to get lubricated, they're not able to be, aroused, different things. So this will definitely help that. How does it help it?
So PRP, let's go a little bit in the depth about that. So platelet-rich plasma, it is one of the innovation that has been used in medicine for a long time. We use it all the time for orthopedic surgery, but now it has a big role in aesthetic and sexual wellness. What happens is body kind of detects the micro injury that happens with the injection that we do, and after that, all the growth factors basically Platelet-rich plasma has many kind of growth factors. One that stimulates the blood vessels, it's like circulation.
Okay.
The one that stimulates the collagen. There are many growth factors in platelet-rich plasma. One is called VEGF, which is called vascular endothelial growth factor, which improves the circulation. Then there is a fibroblast growth factor, which will improve the collagen stimulation. So what happens is once we inject it, body kind of recognizes that there's a micro injury, and it will send all the cells there, which will help to boost the new circulation and improving the vaginal tissue, as well as it will also improve the lubrication and moisturizing.
Okay, great. That's wonderful news because now with
Mhm.
PRP, women don't have to suffer
Mhm.
with all this, just not being able to
Mhm.
have sexual function.
Yes.
And it's great to have this around. Is this something that insurance typically would cover, or is this something that's considered self pay?
So it is a self-paid service. Definitely, I hope, and in long term, I hope insurance will start covering it because it really works.
Yeah. So again, referring to
Mhm.
sexual health, it's going to help give the woman
Mhm.
kind of a well-being. It's going to
Mhm.
help her mentally, it's going to help her overall, when she has good sexual
Mhm.
function, she's going to be able to be in a much better state.
Definitely, because it's not only about the bedroom, right? It's about when you walk in the room, you will see
Yes.
the difference because
Yes.
women will have more confidence.
Yes.
They will kind of accept their body better, and this is how it works. So,
Right. Yeah, that's great. I'm so happy. I'm so happy that that's available now.
yes, I am too.
Now tell me a little bit about, does it hurt? Is it uncomfortable?
So, I would say pap smears are more uncomfortable than this.
Oh, okay. Well, that's good to know.
Yes, and normally the only pain that patients will feel is when we are drawing the blood. After that, the private area is kind of numbed up. So after that, patients don't feel anything; they just feel a little bit pressure.
Oh, wow. That's
Mhm.
great.
Yes, it is
Okay.
great.
So every woman that's suffering from this kind of, vaginal
Hmm.
dryness or just not being able to have good sexual function,
Hmm.
this is a great procedure for you to seek out to resolve that.
And the interesting fact is, Jackie, that normally we recommend 3 sessions, right? First session, we have to kind of really pull the patient in, try to convince that it works, so they come, right? And the
Yes.
second one, they do come. But the third one, they come directly without even me asking. So
Okay.
it really works because they feel the difference, so they want to come.
Great. Okay. So with that being said, how much time? So how much time between each treatment?
Usually 4 to 6 weeks.
Oh,
Mhm.
okay. And that's about, usually they'll start seeing improvement, what, after the first one?
I have seen patients getting effect the same night.
Wow.
Okay. But normally, I would say within 2 weeks, definitely they will see the difference. And after 3 sessions, you will see the full effect. And after that, only once a year as needed.
Wow, that's amazing.
Mhm.
Okay, so with that being said, let's talk about the male. So are you
Okay.
seeing that couples are coming in there to do this together?
So yes, I have seen that, and because it's a it's like a dance, right? So we don't want one partner to be completely ready to go, and the second partner is not dancing in the tune. So definitely, I recommend all the couples to come together and enjoy the journey together.
Yeah. So that's a great point
Yeah.
that you're saying it's a dance. I love
Yes.
that because yeah, the connections with two
Mm-hmm.
partners
Yes.
and then you want them basically on the same
Mm-hmm.
page so that they can really kind of
Mm-hmm.
benefit from the procedure.
Yes.
Okay, so explain to me how it is for the men.
So it's very similar concept, right? It's the same platelet-rich plasma, which is injected into the private area, and that will basically improve the arousal. It will improve the enhancement, and also it actually increases. It's known to increase size also a little bit.
Okay, well that's men, did you hear that? It's also meant to increase the size. It can also
Mm-hmm.
help that.
Mm-hmm.
So, and this is very, again, for 3 treatments
Yes,
approximately.
the same concept. Three treatments with very minimal pain. Repeat it again. 1 second.
Wow. Yeah.
So it's usually the 3 treatments that are recommended for the best effect.
So, the science, so the science behind the PRP
Mm-hmm.
is the same. Draw the blood.
Mm-hmm.
It's for the growth factor
Mm-hmm.
to be injected,
Yes,
and that's where kind of it helps the collagen. All the 3 things that you had
correct.
mentioned before.
Because it's like waking up the area, right? I
Yeah.
normally call it like biological rebooting, right? Because after menopause, after having childbirth, or after a certain age, everything goes in like airplane mode. That's what I would
Yes.
call. So this is like wake up. It's like
Yes.
basically a little cheerleaders who go there and they tell your cells that wake up, let's repair and regenerate.
Yeah.
So that's how it works.
And that's how they feel alive again. It's like,
Correct.
come on, wake up. Let's
Wake
get it
up.
going.
Yep,
Okay,
totally a wake up
awesome.
signal.
Great information. And so again, couples can go there together,
Yes.
or the man,
Mhm.
or separately, or the female, or the
Yes.
wife, husband, or just separately. Okay, that's great information. So let's go into the hormones. So I want to know a little bit about biological. So
Mhm.
you hear of HRT, which is
Mhm.
hormone replacement therapy, and then you have BHRT,
Correct.
which is biological hormone
Bioidentical.
bioidentical
Mhm.
replacement therapy. So tell me the differences between the two.
Okay. So the traditional hormone replacement therapy, I would say it started like in 1940s, right? And that's when after a few years it was approved by FDA. It is basically made from pregnant mare's urine. So it's an equine hormone, estrogen, and it is if you go more into the detail, it's like estrone, which is E1, which is a type of hormone that is used for many reasons, right? But as time went by, we know that E1 is not a very good kind of hormone, estrogen. We normally would prefer E2 or E3. In our body, all three are produced. But when the body's hormone starts to go down, we want to replace it. I, as an OBGYN, would prefer E2 or E3.
Okay.
So traditional hormone has estrogen only, and it is very good. It had its effect, but initially we started as oral medication. Um, as time went by, they noticed some side effects with it. That's when everybody started freaking out about the hormones. That's when everybody paused that do not use hormones anymore. But that's when bioidentical hormone came in picture.
Mm-hmm.
They are basically plant-based. They are made from soy and yam, and it is more identical to human estradiol as compared to the conjugated estrogen.
Okay. And you get more than one hormone.
Correct.
You get with the other, it was just one.
Yes. So the original traditional hormone is one. Everything else is bioidentical. Even the progesterone that we give these days for hormone replacement is bioidentical.
Okay.
The patches that you must have heard of, everybody uses it. It's a bioidentical hormone.
Okay.
So,
So how do you recommend? So a patient comes in to see you,
mhm.
and then you're able to. Do you find out from blood work? Do you
Yes.
find out from the symptoms?
So
Tell
first,
me.
always it's a detailed history, right? Comprehensive history to know their medical condition, to see if they are even a candidate for hormone replacement therapy. Once I rule that out, that I see that they are a good candidate, then we order the blood work. After the blood work, is done, we sit down and then we go over the results and see which hormone is deficient and which hormone is needed in their case. And it is all personalized. I wish one treatment would fit everybody, but it is not like that. I have two different patients with exact same age, same condition, medical history, but they have different requirements. So it totally is personalized and customized.
Yeah, well, that's the beauty of it too. That's the
Yes.
nice thing, that you're not getting a cookie cutter
Correct.
type treatment like the other one.
Yes.
This is one that's more specific to your
Mhm.
needs. And so once patients get on this kind of treatment, do you find that they start feeling differences in 2 weeks, 3 weeks, 4 weeks?
I would say give your body good 6 weeks
6
for a
weeks.
good effect, right? And after that, if that dose works for you, that's great. We continue with the same dose. But if you think that I feel better, but I want to feel more, then definitely we can increase the dose as long as it's controlled, it's monitored by a physician, and as long as we continue the follow up.
Okay. And do you find that this treatment is something that you are basically going to have to do for the rest of your life?
So interesting fact, okay? The life expectancy for male and female in US is 75 to 80 years. We start declining our hormones when we are 30s and 40s.
Yeah.
So it's kind of unfair to live your life with very little hormones for 30 or 40 years of your life. So I would say that you can continue as long as it's monitored and there are no other contraindication. You can continue it for 20, 30 years and enjoy your life.
Yeah. So it's interesting that we're going to live without the hormones
Yep,
longer, especially now
definitely.
because life expectancy is
Yes.
higher than with the hormones.
Yes.
But that's another reason that we need to take care of ourselves.
And we need to talk about it because there
Yes.
is so much awareness that needs to be spread that hormones are uncontrolled hormones are dangerous. Controlled hormones are safe.
Right. Yeah. And I know that for women,
Mhm.
my age group,
Mhm.
our age group, we definitely, there's so many unknowns.
Yes.
But I think there's a lot of platforms out there
Mhm.
now, like this one,
Mhm.
that we're talking about it
Yeah.
more.
Mhm.
We're trying to talk about it, shed more light. I've seen
Yes.
recently, I saw on Instagram
Mhm.
where there was a panel of really great women
Yeah.
that are all getting together to really talk about it and kind
Yes.
of give us all the information. Because, yeah, before our parents didn't talk about this.
You are talking about that, Jackie. I have been OBGYN for 20 years. How many patients have actually brought up the sexual health is very it's a kind of a shame. I take care of
Yeah.
women and they
Yes.
still don't open up about their sexual health. So this is the time to talk about it, and we have treatment available. So why not to talk about it and treat it? You know.
Yeah, absolutely. Okay, so let's go into some glow time Q&A questions,
Okay.
all right? So what is one wellness ritual that you swear by?
Gratitude,
Oh, I love that one.
definitely. Hydration and exercise, move.
Yes, you have to move.
Yes.
And even if we just have to get up, walk around.
Yep. At
I
for
know,
your workplace, at
yep,
your home.
yep. I know my trainer told me
Mhm.
that. He's like, just get up and walk around.
Yes.
Park at the farthest place that you need to
Yes.
go, get up, go to the furthest place to go
Yes.
use the restroom. Don't go to your in your office.
That's
Just go
great.
somewhere
Yeah.
else. Just get up and walk around. That really makes a difference. And I've seen that over and over and over
Mhm.
again. Everyone's talking about just getting up and
Yes.
moving. Okay, what's the biggest myth about hormones?
That it causes cancer. So that's where I would again emphasize that hormones have been in market or in use for many, many, many years. It took almost 50 years for bioidentical hormones to get approved. So now that we have newer and newer hormones, I'm expecting by 2040, I think everything will be FDA approved, and it is safe. So do not worry. Go to a doctor who knows about it, and then definitely try using it.
Yes, for sure. Okay. Yes, so if every woman knew this one thing about her body, it
Mhm.
would be
It's magical, and you
yes.
are not crazy. It's just
Yes.
hormones which are a little bit off.
Yes, it's magical. So, did everyone hear that? Our body is magical. We really have to tap into that because we really don't know, or we forget, or
Mm-hmm.
really just some of us don't realize that.
Yes.
Our body is magical. Yeah.
Yep.
Awesome. And the O shot in one word.
Reclaim.
Okay, I like that. Reclaim.
Yep.
Would you say the same for the P shot?
Reignite
Reignite.
the
I like
spark. Yeah.
that.
Why not?
Yeah, I like that. All right. Well, Dr. Sutaria, thank you so much. Tell me where patients can find you, where they can go to look you up and find more information about what you offer.
Yes. So we are on Google, we are on Instagram, we are on Facebook. My company is called X Factor MD Med Spa. We are located in Galleria, Houston area, which is our address is 5251 Westheimer Road, Suite 710, Houston, Texas 77056. You can always call us or text us at 346-485-6869 and come for a consultation and we can talk all about it.
All right. Wonderful. Thank you, Glow Babes. Thank you for tuning in. Don't forget to like, share, subscribe, and thank you.